So let's take a look at this frontal chest radiograph of a young patient. We can see that there is a lobulated lung mass projected over the left middle to lower lung zone. There is no other lung lesion, no periffusion seen. So let's take a look how we can further characterize this lesion. So first of all, it has a lobulated, well-defined margin, very likely to be intrapulmonary in position. However, there is also some tortuous prominent structures which is radiating from the left hilum. So very likely there are some prominent pulmonary vessels communicating to this lesion. And this lesion likely to be vascular in nature, which looks like vascular pouches, but we do not see definite communication to the pulmonary vein, but at least we can see the arterial portion. So actually, this appearance is highly suggestive of a pulmonary arteriovenous malformation. So when we consider this possibility, it is actually very rarely seen sporadically in normal individuals. But we need to consider the possibility of underlying syndrome like hemorrhagic hereditary telangiectasia (HHT), and this kind of patient commonly will have different kinds of AV malformation throughout the body. Lung, liver, and the brain are the most classical position. So in order to confirm the diagnosis, you need to do a CT 4S, including the arterial phase, and the scan which required should be covering also the entire liver in order to demonstrate possible associated AVM or even some angiomatosis. If this kind of patient starts to have some neurological symptom, you need to consider two possibilities. One, because of the pulmonary AVM, so basically there is a direct right to left shunt, so they can have some emboli, especially septic emboli, directly travel to the brain, so they can have increased risk of brain abscess, or it can be due to bleeding from underlying brain AV malformation. So we need to consider the possibility of HHT whenever we see similar lesion like this, which is like a vascular pouches with apparent communication with the pulmonary lung markings, and usually such vascular shunting effect will result in dilatation as well as tortuous course of those vessels as well. So you do not need to be very confused whether they're just coincidentally having some lung markings projected over the lesion or whether they're genuinely communicating. There must be some abnormal appearance of those communicating pulmonary vessels.